Now that we're a bigger organization, one of them is getting alignment even within medical. And there's a lot of moving pieces and a lot of different functions working independently. But I think it goes back to having a strong vision of what you want to achieve. That's key. And then how you effectively communicate that so that all these different players and stakeholders understand why you're trying to do what you want to do. And will say I've had varying levels of effectiveness in being able to do that. But when I do clearly communicate the vision, that's when you can see the light bulbs go on, and that's when you get the buy-in. And so I think it's important before you start the enacting change is map that all out and lay it out, and then intentionally think, how are you going to roll this out, and start thinking about who's going to push back on this, who's going to be your champions to try to bring this forward, and have that awareness, and utilize others. And so it took a stepwise approach. Obviously, you got to get the leadership bought in first that this is something we should be doing and we need to be doing as an organization, and then having a way for the rest of the team to understand how it's going to benefit them. So it's framing up in, we're not just asking you to do this. This is the reason, and this is how your piece fits into us being successful, and then how we're ultimately going to be able to show that what your work that you're doing is really making a difference, and an impact.